Hello Aneka, it's nice meeting you actually, because we spoke on the phone and you told me a little bit about your problems. So can you tell me again please why you're here today and what are your problems, what your symptoms are?
Of course, yeah. So I have recurrent bladder infections, urine infections.
Yes.
They're pretty awful. I'm getting them almost constantly. They bring me a lot of pain when I'm passing urine, discomfort pretty much all the time, you know, even if I'm just standing, that sort of thing. Having to go to the toilet a lot. I can't hold the toilet, so as soon as I get the urge to go, I have to go straight.
Do you wet yourself sometimes?
I would, yes. Have incontinence if I try and hold it at all. Yeah. And it also refluxes back up to my kidneys if I hold it.
All right, so you've had problem with reflux in the
Yes, which then gives me kidney infections, and it just makes me so ill. I just can't carry on like that.
And you had your baby 5 months ago?
5 months ago I had the wee one, yes.
And did you have, what delivery did you have? Did you have vaginal?
I had a natural delivery, yeah. It was a very easy delivery. It was brilliant. I couldn't have actually asked for a better delivery, but throughout the full pregnancy I had a constant urine infection. And the pain was horrific. It was very sick. It actually was making me really ill. Just not good at all.
And what the symptoms have been since you had a baby?
So more the urge, I can't hold it at all. I need constantly.
Do you think they're worse?
I would say worse. Right. Yes, worse. More so just with the constant needing. I need all the time. And
it must be really affecting your life.
It is, because when you can't hold it,
yes,
it stops you going out, it stops you doing things with friends, you know, even with the little one, you know, we're not going to certain groups because I know there's no toilet there, or, you know, things like that.
So your whole life revolves around
the toilet.
Toilets, basically, yes, whenever you go. And are you restricting yourself with fluid intake or?
Yeah, if I know, you know, that if I'm at work, say, I can't be going every 5 minutes, every 10 minutes to the toilet, so I'll just not drink, which then makes the infections worse. So it just has a knock-on effect, and there's constantly consequences for my actions, and it's just not great to be living like that anymore.
What about your sex life? Has this been affected?
Yeah, it's so uncomfortable. I'll just put it off, to be honest, which then affects my relationship.
Yes.
And causes all sorts of issues. With intimacy, you just shy away from it, and it becomes more of a fear, because you're thinking you know it's going to hurt, so it just stops you, which then makes it even worse.
Oh, it must be really awful for you.
Yeah, it's pretty bad.
Right. So now you've seen our website and you've read about the treatments. What are you hoping to achieve with the laser treatment?
I hope just to make life just a little bit more comfortable. Just give me a little bit more freedom to be able to do things when I want to, or if I want to. Just that. Just with work as well, making my day a lot more easier. You know, not having to leave customers and then come back to it and remember what I'm doing, or things like that. And just with the wee one, being able to go out and not worry all day would be fantastic.
Great. Now, we sort of already explained to you about how this treatment works, and that it is internal treatment of entire vaginal canal, and with extra treatment for the anterior vaginal wall, which is the one that supports urethra and the base of the bladder. And the treatment of this particular part should help your symptoms, as well as obviously whole vaginal treatment, because you've had a baby, so the vaginal canal is a little bit stretched, and would help to tighten it up and give urethra support as well. So we're hoping that this is going to make a difference to your symptoms in terms of reducing your symptoms, and ideally would be obviously if your symptoms went away completely, but hopefully with few treatments they're going to be much better. Do you have any questions at the moment you want to ask me about how the treatment is done? I mean, I will be telling you as we're doing it what I'm doing, so obviously we put some anesthetic cream for the external part. The internal part is practically painless, maybe a little bit of discomfort, but usually it's very very well tolerated, and it's pretty quick. You will be able to go home, go to have a lunch or do usual things after the treatment. You'll get instructions after the treatment what you shouldn't be doing. For example, not having an intercourse for 7 days. It's recommended, but otherwise, with the normal skincare and hygiene, it's very much the same as usual. Is there anything else you wanted to know or ask?
No, I don't think so.
So what I would suggest, given the severity of your symptoms, will be that you almost certainly will require 3 treatments, and there should be improvement pretty quickly after the first treatment. You should notice some changes. It's hard to say to what extent you will benefit after the first treatment, but your symptoms are quite severe and extreme. And I would think that you will require 3 treatments to get that maximum effect, maybe even more, but we'll see about that later. So the treatments should be really done at monthly intervals. You have one today, then you could have another one 4 weeks later, and then again 4 weeks later. We'll do review. We'll contact you immediately after treatment. We'll contact you over the next few days. If there are any problems or anything you want to ask, you can just call us anytime, and we'll discuss it with you. And if you need to be seen for any reason, we'll bring you back, and you'll have a check in here, just to make sure everything is going fine.
Okay.
Okay.
Yeah.
So you're happy to go ahead with the treatment today?
Yeah, that'd be great.
Right. Okay. Okay, that's it. Be done. How was it then?
Fine. Yeah.
Okay, good, excellent. I'm glad to hear this. Okay.
So when whatever's actually happening, you don't feel anything. It's all you feel is just it turning slightly, turning slightly, turning slightly. But I can't imagine how to describe what that felt like. Not painful, just it's happening, slightly uncomfortable.
Yeah.
But fine.